I'm here today because in my last year of high school, my best friend was diagnosed and passed away from cancer. That has truly inspired everything that I do. For the past 5 years, I've been in a lab working on a drug for cancer survivors. This drug has already shown its benefits in preventing cancer in colon and breast cancer patients and reducing the risk of lung, prostate, and endometrial cancer. Taken during treatment, this drug has shown that it has effects on being able to help patients get their full chemotherapy, allowing them to benefit from their full chemotherapy dosage. Taken after treatment, this drug has shown promise to reduce the chances of recurrence in colon patients by more than 50%. We are now exploring this in a phase 3 clinical trial across Canada and Australia with over 900 patients. Other benefits of this drug include better quality of life, reduced cancer-related fatigue, anxiety, and depression. A lot of patients will notice their blood pressure improving, an improved cardiovascular system, and a stable body mass index. I first heard about this drug when my best friend Jane was diagnosed with Hodgkin's lymphoma. Feeling powerless, I would try anything I could to help her cope and manage with her disease. I suggested she take this treatment as much as she could tolerate while she was going through chemotherapy. I was excited and encouraged by the results. She seemed to sleep better, smile more, and be more energetic. So what is this groundbreaking drug? It's exercise. We all know exercise is good for us, but we rarely use it as medicine. It wasn't until I started working with children recovering from cancer I realized the impact that this fundamental behavior can have in cancer recovery. I started my graduate degree in the behavior medicine lab at the University of Alberta. This lab focuses on exercise and cancer control across the spectrum, from prevention to survivorship. We're trying to refine the exact dose of exercise that is the most beneficial for cancer survivors. We'd like to hand somebody a prescription for exercise when they are diagnosed with cancer. My research personally focuses on how to translate exercise and cancer information to clinical, community, and healthcare practices. To get people started is one thing, or to tell them to do it, but it needs to be more than that. We're now developing tools based on counseling techniques and written materials in order to get this information across. Tools like this one. This is a guidebook that gives a prescription based on frequency, intensity, time, and type of exercise, but it goes into more depth. It talks about how to make exercise enjoyable to encourage adherence. It talks about different barriers cancer patients and survivors can have. It also goes into detailed planning, so planning out how you're going to accomplish your activity, with whom, when, and goal setting. Exercise is the most under-prescribed medication out there. If it was a drug, it'd be handed out in abundance to all cancer survivors. My goal is that when somebody is diagnosed with cancer, they receive a guidebook like this one I just showed you, and that they're referred on to an exercise specialist for constant support. This will improve quality of life, health outcomes, reduce the economic burden on our medical system, and most importantly, it'll save lives. Thank you.